This segment of Delmarva Life is brought to you by TidalHealth.
More than halfway through the first month of 2022, how's your resolution to lose weight going? Are you looking to shed some of those unwanted pounds you may have picked up over the holiday season? I am. Well, contrary to popular belief, losing weight doesn't have to be a struggle. And Dr. Sandra Palavecino of TidalHealth Medical Weight Loss and Bariatric Nutrition is here to talk about the impact of weight gain on your overall health. You also have some great tips on how we can safely trim our waistline. Welcome
Absolutely.
to the show.
Thank you for inviting me.
So the ideal weight ranges obviously from person to person, and obviously we always hear about your body mass index. What is a healthy body mass index, or BMI, and how do you know if you need to lose weight?
Right, body mass index is one of those calculations that we have come up to try to compare patients with another and know who is at more risk. So a normal BMI is considered between 20 and 25, and after that will come overweight or obesity. There's other markers too, like body compositions. Those also help us to know how much weight somebody will need to lose to recover their metabolic health. For example, percentage of body weight. That's also very important.
Yeah, because I mean, you obviously, someone who's like muscular might weigh more and not necessarily have what's considered a healthy BMI, right?
Exactly. They could have a high BMI with a normal metabolism.
Gotcha. Okay, so depending on the person's goal, bariatric surgery is an option. How do you know if you're a candidate?
Right, we reserve those procedures for patients with body mass index over 40 kilograms over meter square. So that's a calculation that your doctor will help you know, and also patients who already have consequences of the disease, for example, diabetes type 2, sleep apnea, or very hardly to treat hypertension.
Oh, okay. So where does TidalHealth Medical Weight Loss and Bariatric Nutrition come in?
Well, we are there to help patients to understand the disease of obesity, how did they start it on them, how can we help them through the process, either in the medical side or with the surgery if it's appropriate.
All right, so how can, you mentioned a few of the things that your weight can affect, chronic diseases, but overall, how can being overweight affect you?
Right, so we divide the consequences of the excess of fat around your body on the metabolic side. For example, type 2 diabetes, high cholesterol, and fatty liver disease. And the mechanical side is when it's about the weight of the tissue that will be accelerated osteoarthritis or sleep apnea or even acid reflux. And the more common right now is the inflammatory, like heart disease or even 13 different types of cancer that are associated with obesity. But most recent, we know that patients with obesity has had a high risk of having advanced COVID disease. So we want to help them through that, so to avoid that.
Sure. Now, a lot of people are gung-ho, especially this time of year, to lose a lot of weight. Is there a healthy amount of weight to lose during a week and an unhealthy amount?
Right, we talk about half to a pound or 2 pounds a week will be healthy or will be expected in a good plan. But also is what is your goal? If your goal is to not only reduce your weight but improve your metabolic disease, we will have a goal of 10% of total body weight loss, and we can divide that in several weeks. If your goal is to overcome, for example, non-alcoholic fatty liver, that will take a little longer because it's about 15 to 30% body weight loss from the total body that you started with, the total weight you started with.
And then what about exercise? How can you safely incorporate exercise into that plan?
Absolutely. So exercise is good for like 100 different other things. So we always incorporate that. Not every patient will lose weight just by exercising. Like you said, some people will gain weight because they gain muscle weight, but it's definitely excellent. It's like taking a medication every day for you to prevent heart disease, cardiovascular vascular disease in your brain, dementia. So we definitely incorporate it as we can, slowly with the patients. Patients with obesity have a harder time to start exercising because of aches, pains, and difficulty breathing. So we have to start small and then bring them up to a good exercise plan that fits them.
Sure. And it feels good too.
It feels good, right?
So
Absolutely.
I've been seeing a lot of people talk about intermittent fasting. Tell me about it. Is it something that we should do?
Yes, so fasting is an excellent way for you to, it's one of those techniques that we use for energy balance in our body. And as we discover the importance of when to eat as much as what or how much you eat, we've been practicing that for several years. So one easy way to start, or an easy way to understand it, is that you want your brain to know there's times that you eat and times that you don't. So in order to practice that, you can start just by consolidating your meals into 3 a day and no snacking in the middle, and you'll be fasting already. And then as you are accessed by our program, we can introduce more lengthy fasting if that is needed.
But it's probably good to have someone like you help you through doing something like that.
Right, because at the end, we want to be fasting not because we are looking at a time, we want to be fasting because we are not hungry, and that is very important.
So that's just one of the many resources you provide at TidalHealth Medical, Weight Loss and Bariatric Nutrition.
Absolutely.
What are some of the others?
So the most important thing for me is to explain to the patient that obesity is a chronic disease, and there's many reasons for it. You may be suffering from one or many at a time. It could be an eating disorder, it could be a hormonal disease, it could be also now 10% of our population is being diagnosed with food addiction. So and there's medications that can make you gain weight. So we want to identify those risk factors in a patient and help them as we go with all the resources that we have for planning their meals or the timing of their meals, or if there's any pharmacological assistance we can give them or guide them to surgery.
So much information, and of course we'll have more information so you can learn more. Dr. Sandra Palavecino, thank you so much.
Thank you for having me.
Joining us this afternoon.
Glad to help.